Welcome to EMDR with Alice. Today we're going to talk about the calm, safe place. So let's just talk about, there's lots of different ways to do the calm, safe place. But I'm going to talk about a couple of recommendations. I found early in my career of doing EMDR therapy that a lot of clients would get triggered when we would do the calm, safe place. The way that I was originally taught was to have clients think of an example of a place that they have been or they had visited where they experienced positivity or calm. And I found that could be very easily contaminated by either someone who had been abusive at some point or another being in the calm place, or some kind of a negative association could come up around the calm, safe place. And so one of the tricks that I learned early on was to adapt the calm, safe place to say some place that you could imagine being. So it could be a place they've seen in a movie or in a magazine, or they have heard someone talk about, and they could imagine being at peace or calm or relaxed in that state. So notice also the shift that I did in the language of, instead of using safe, we would actually elicit or ask for examples or a place that they could imagine being at peace or calm or relaxed. Oftentimes this is a place that is in nature. So as you're constructing that with the client, again, using a place that they could imagine being if they were there. They could imagine being and feeling more relaxed or feeling calm. Another trick that I've used is some clients really struggle, especially with complex trauma, with coming up with guided imagery. And so they have a really hard time imagining a place or coming up with the imagery in their mind. And so it can be really useful to actually go on to like Google Images or some other kind of search engine and type in, like if they say they could imagine a beach scene or being in the woods, and just type those into the search engine and then have them look through the pictures and choose one that when they look at it, they immediately begin to feel their body start to respond by softening or relaxing, or they maybe start feeling space in their mind as they look at it. And then you pull that up on your screen, have them look at that while they imagine being there as they're looking in that state. Or they can just even notice what it feels like as they look at the image to feel themselves relax. And then you add the bilateral stimulation to install that resource. Another way you could do calm, safe place, and you could do this with adults or children or teens, is also in a sand tray, if you have a sand tray. So you have them pick out figurines and set up their calm, safe place in the sand tray. You want to watch for kids to make sure they're not putting like scary looking figures or scary looking figurines in there, and kind of asking them about those. Maybe even you might help them create barriers around the edges if they need a boundary, or they feel like they need a boundary in their calm, safe place. Once they've created that in the sand tray, then you can have them apply bilateral stimulation, again, installing that positive sensation that may be coming up in the present moment as they're looking and imagining being in that space. Another way that I've done calm, safe place with kids is having them draw a place that they can imagine that would be just really fun and relaxing, and they could just dream and be silly and be themselves. And so they can draw or paint that picture, and then again we add the bilateral stimulation. I've also done where we've created a fort tent in the office, where we bring in tent sheets or blankets, and we create a tent in the office, and then they get to bring all their favorite things that's in the office space that feels cozy and really peaceful for them. Maybe smells, because I have essential oils, all kinds of different things they can bring into that fort tent. And then while they're sitting in that, then we may tap in that present moment experience of feeling calm and at peace. And so maybe that space is created then in your office space. The same can be true with adult clients, of having them find a cozy place in the office. Maybe it's in the seat, maybe you have blankets or a pillow that they can squeeze. notice what it feels like, feeling their body relax, and then beginning to tap that in. So think about Calm Safe Place now in a way where you can adapt it to the client, and there's lots of different ways of doing Calm Safe Place. And the purpose of it, again, is to help with creating a present moment experience with an imagery, or even it can be imagery in the present moment in your office, or a present moment imagery of something they're looking at on a screen, or something that they're imagining in their mind. And then you're tapping in using the bilateral stimulation, using the script that Francine gives us for Calm Safe Place, of then getting that all the sights, the smells, all the senses involved. And as long as it's positive, we move forward, attach a name or a label to the Calm Safe Place, and then we test it out with something that's mildly disturbing or mildly annoying, not even disturbing, but just irritating or mildly annoying. Testing that out so that we can see, can we go between a distressed state and a calm state? So that's all for today, as we talk just a little bit more on expanding Calm Safe Place.